there are some things, I call them modifiable, not modifiable. There are some things which we can do nothing about to prevent breast cancer. That's being a woman, or being getting older, or, a family history, or having dense breasts. So, some of us have dense breasts, that itself is a risk factor, or a reproductive history, whether we've had a child, or what age we had a baby. There's nothing we can do about it. And these are risk factors. But there are some things which are in our hand. And I think the most important out of all is exercise. Because, exercise influences the hormone levels in our body, the estrogen and progesterone. And we know that exercise, a lot of studies have been done, and they show that it reduces the breast cancer risk, not only by boosting the immune system, but by having less body fat, which actually translates into lower estrogen levels. So, which actually prevents breast cancer. So, and plus, of course, it's mood boosting, anxiety, and all of cardiac, heart protective, and all of that. But I always say that if exercise were a drug, it would be packaged and marketed, like all these newer devices or genomic tests. So exercise, I feel, is the most important factor, because it keeps your weight down, keeps the fat content in your body down. And the type of exercise is something which makes your heart rate go up, which is cardio, like 30 minutes a week, 30 minutes a day is very important. And I think it's important you give yourself that much time, self-breast examine, and exercise. The others to prevent is, I have this ABCD. A is avoid alcohol, tobacco, smoking, oral contraceptive pill, hormone replacement therapy for a long time, and processed foods. B is for be breast aware, breastfeed, for at least for breast cancer. And I always also add be vaccinated for, hepatitis B, which prevents liver cancer, and HPV, which prevents cervical cancer. 80% of cervical cancer is prevented by this vaccine. And countries have eradicated cervical cancer because they've eradicated HPV. So this is something we need to really, really think about. C is for calm. We know that the whole of the West is moving towards the East with yoga, meditation. So all of this will decrease the stress level. So C is for calm. D is diet, having a good diet, which is less in trans fats, enough vegetables and fruit. And there are a lot of studies which have shown that the risk of developing breast cancer and colon cancer is strongly linked to the diet you take. Yes. E is for exercise, F is for know your family history, and S is for sleep and screening. Screening we've already touched about, but sleep is, there was a study in Spain which showed that, if you sleep before 9 p.m. or if you have 2 hours between your last meal and sleep, your risk of breast cancer is 25% less. So it used to be called a shift-based cancer, because more of nurses and people who are doing shifts were developing breast and prostate cancer, because I think it messes up with your hormone levels in your body. So I think these are all things which are completely in our hands. It's trying to have the last meal at 7 and then not going to sleep at 9 p.m. is something which our grandmothers used to talk about.
Yes, but which we have kind of lost.
We've kind of lost, yeah. They used to get up before sunrise and go to bed by 8:39. So all of those things were, I think, the right.
Yeah.
Yeah.